This is the fourth part of our Fastidious gram-negative rod lecture. And in this lecture we are going to focus on the organism Pasteurella multocida. Now the Pasteurella are related to the Haemophilus organisms, and there are 17 species of Pasteurella that exist. However, Pasteurella multocida is the organism that is most commonly associated with human infection, and the virulence factors are not well characterized. Pasteurella multocida normally causes infection after a bite or a scratch, and it can also cause respiratory tract infections as well as life-threatening systemic diseases like meningitis or bacteremia. It is primarily a zoonotic organism. So this organism is normal flora in animals, and animals can become symptomatic when they're under stress, and the organism will start to grow and cause problems, and this is called shipping fever. So what happens is, in an individual that gets bitten or scratched by an infected animal, it can cause a localized cellulitis, inflammation, lymph node swelling or lymphadenitis. It can progress to osteomyelitis if the animal has a very penetrating bite and actually bites into the bone. The organism can also cause a chronic respiratory disease. This is usually more common in patients with an underlying lung disease like emphysema or asthma. And what happens is it will colonize the oropharynx after it's been aspirated. It can also lead to systemic infection, which is much more common in immunocompromised individuals and in individuals with liver disease. And here's a typical Pasteurella multocida infection, where at the site of infection you'll get inflammation, redness, swelling, and you could see where the bite mark is. So it's carried as normal flora in healthy animals, sheep, dogs, rats, and cats. Now transmission is usually from the bite or scratch of an infected animal, and cats are the most notorious for causing Pasteurella multocida infection, but dogs can also. So of course the best prevention is to not get bitten by an animal, especially an infected animal. But I mean, this is normal flora, so the animals may not have any symptoms at all. Stressed animals can, but dog or cat, it's just normal oral flora. Just like we humans have normal oral flora, so do animals. Treatment: penicillin, it works fine, and it is one of the few gram-negative rods that are still sensitive to penicillin. In order to diagnose Pasteurella multocida in the laboratory, you would need to get your specimen in, and usually this is going to be material from a wound specimen. It might be a blood, it could be a respiratory tract, and in a case of a meningitis, it could be a cerebrospinal fluid. And under gram stain, Pasteurella is a pleomorphic gram-negative coccobacilli that can also be somewhat filamentous. It can be a rod, like a normal sized rod. It tends to show some bipolar staining, so it stains darker at the ends than it does in the middle, which tends to make it look like a safety pin. On agar, usually you're going to get more of a coccobacillus that you see under the microscope. If you grow this organism in more of a broth culture, or if you look at an infected tissue specimen, you will see the rod form. And here is gram stain of Pasteurella. And you're going to see that usually the gram-negative rods, they all tend to look alike. They're pink rods. Some might be a little smaller, some might be a little larger. There's only a few that have a very distinguished look to them that would make them be, a reason to gram stain them. So gram-negative rods tend not to be stained in the clinical setting. If it's known to be a gram-negative rod, usually you're not going to go to a gram stain, whereas a gram-positive cocci you might. Here's Pasteurella in a tissue specimen. You can see these nice gram-negative short rods. So under the microscope, usually you're going to see very tiny gram-negative rods where you get the bipolar staining, where the ends stain darker. So the bipolar staining is much more prominent if you use a Giemsa stain or a methylene blue stain. It's not as prominent if you use gram stain. So this organism will grow on 5% sheep blood agar, but it will not grow on MacConkey agar. It will form a smooth convex colony on blood agar in 18 to 24 hours. It's non-hemolytic. However, underneath the colony there may be somewhat of a green discoloration, which makes it appear to be alpha hemolytic, although it is not hemolytic. And Pasteurella is described as having a musty odor, but again, we never smell our plates in the laboratory. And no very specific environment is needed. This is considered a fastidious organism. However, it does grow on blood agar. We usually will incubate in a CO2 incubator, but it is one of those organisms that won't grow on MacConkey agar, whereas our typical gram-negative rods do, so it is considered fastidious. Again, growth on 5% blood agar or chocolate agar, that musty odor, and one of the very distinguishing characteristics is no growth on MacConkey. It is oxidase positive. And here you can see Pasteurella, nice growth on blood agar, nice growth on chocolate agar, and you can see the streaks on the MacConkey agar, but you can't see any organism growing, and that's because Pasteurella does not grow on MacConkey agar. So this is what you would classically see in the clinical laboratory, because in the clinical laboratory your specimens are commonly going to be inoculated onto blood, chocolate, and MacConkey at the least. Some labs will grow on other selective media as well. So these organisms are fermentive, so they will have an acid butt. They will be yellow in the bottom of a triple sugar iron agar. We talked about that in the first week lectures. It will not grow on an oxidative fermentative media. It is catalase and oxidase positive, and it sometimes these reactions can be a little bit variable. A distinguishing feature we've already mentioned, no growth on MacConkey. It is sensitive to penicillin. It's indole positive, urease negative, and ONPG positive. And we're now going to move on to the 5th section of the fastidious gram-negative rod lecture.